Good morning. The topic of the day is facelift scars. I noticed there is a lot of misinformation about facelift scars. So I want to give you the essential information that you need so you can be prepared if you're considering a facelift, and afterwards you know what to do if the scars don't satisfy you 100%. So of course, facelift scars are very important and as a crucial part of the success of a facelift. We try to place scars in strategically key position in which they're less visible. Again, the goal is at the end of the day to make it as undetectable as possible. Scars in facelift are placed in different position according to the technique of the surgeons, but overall is important also not to compromise the final result in order to deliver a fine scars. So it's always a compromise between a fantastic result with the scar they're less visible as possible. Again, what are the factors that causes bad scarring? Patients think it's just a worse technique, it's the plastic surgeon's fault, and sometimes it is true. But there are three factors that contributes to bad scarring, and these are, number one, your genetic background. The genetic background will dictate also how well you're gonna scars. If you have a tendency of hypertrophic or keloid scars, you're a higher risk of developing a bad scar during a facelift. Darker color people have worse scars than a lighter texture patient. And so you have to be aware that if you are African American, Asian, Middle Eastern, you may have a tendency to scar worse than a Caucasian patient. Now, what is the second most important factor is technique. Of course, there are different techniques that we use. I definitely try to minimize the scars by using a stitching that will not leave any stitch marks. I take my time to close the incision. Some plastic surgeon will delegate that to their assistants. They do more than one case a day. My philosophy is one case a day. You're the case of the day. I do from the first stitch to the last stitch because you deserve the best. Again, that's very important. I'm Italian. I call it a Italian designer facelift, so it has to be stitched to perfection. But the third and most important cause of bad scarring is tension on the scars. Now, the tension will have the scar spread a little bit. But remember, you need tension on the facelift flap in order to make it long-lasting and to deliver a good results. Of course, my main concern is that the facelift will be a long-lasting. You're devoting a lot of time and you're spending a lot of money in facelift surgery, and if it doesn't last more than a year or two, you wouldn't be happy. So my question is to you, would you rather have to revise a facelift because the doctor didn't put enough tension and the skin has relaxed, or to revise a little scar because the tension and caused the spreading? And the revision of the scar is very easy. It's done under local anesthesia. It takes a few minutes. The timing of revision is very important, though. It needs to be done at a timely fashion. You do it too early, there is still tension on the scar and the scar will spread again. So we need to do it at least 6 months, if not a year, after the original surgery in order to deliver the best result. My scar revision rate is very low. It's, I would say 1-2% of cases. but I always tell patient, look, I'm here for you. If by any chance the scar does not satisfy you, and to be honest, I'm very picky. If I see a scar that doesn't look good, I'm the first one who wants to revise it because my signature is on your face. So scar revision is very easy. It needs to be done at an appropriate time, but at the end of the day, it's a lot easier to revise a scar under local anesthesia than to have redo the full facelift because the surgeon has not put enough tension on the flap and the skin is sagging again, especially in the neck. Again, there are techniques that I use in order to minimize the tension, the VIP closure. Look it up on my website or on Instagram, and special technique by pulling the muscle first and the skin later. Technique in which I place the scar inside the ear cartilage and not in front. So that's experience. And that is what a good plastic surgeon is all about it. But again, focus also on the natural result of the face, how long it will last. The scars are important, but again, they are easy to revise if you have a predisposition of a scars or so on. So, of course, at the end of the day, you want to make sure you can wear your hair up. In guys, it's very important to place the scar in a way it's not visible. Again, that is really crucial. But again, it's easier, and the point that I'm trying to make here and leave you with this is it's not always the plastic surgeon's fault if the scar doesn't heal well, considering other factors. Talk to your plastic surgeon. I'm always here for you. My main goal is your satisfaction, and I will not stop until you're fully satisfied. So this is about facelift scars. It applies also to different other scars, but it's important because facelift scars are most visible, and you want to go out like you doesn't show you that you had a facelift. Of course, other telltale sign is to pull horizontally and you end up with what we call a wind tunnel look, which is dreadful. So it's a combination of things to deliver it a best result. I do facelift for a living, and I think I deliver a excellent result. So stay tuned for more information.